All right, we are live.
Excellent. Good morning, good afternoon, good evening to everybody joining us from across the country and across the globe. We are thrilled to welcome you today to SpinSci's webinar, where we're diving into one of our most powerful tools in our modern healthcare suite, which is our Operators Console. We've got just a fantastic session lined up, full of real use cases. We've got smart workflows. We're going to be showing you a full end-to-end demo and how this is going to make a real impact on your organization as well. So first, let's go through and meet our experts who are joining us live here today. So we've just got a great team of speakers. Justin, if you could just go to our speaker slide.
Absolutely, Nancy.
So we've got Ashvin Asava, our Chief Revenue Officer here at SpinSci, who's the voice behind many of our game-changing partnerships that we've built. Ash, do you want to go ahead and say a word about yourself, please?
Yeah, well, first off, very excited about speaking about the Operator Console product. A little bit about myself. I've been at SpinSci for 7.5 years. I'm an avid golfer, and I'm very passionate about healthcare workflows.
Excellent. Thank you so much, Ash. And we've got Rohit Padaraju, who is our VP of Product. He's the architect behind this very console that we are spotlighting today. Rohit, let's hear a little bit about yourself.
Absolutely. Again, very excited to be here, talk about one of the revolutionary products that we've built to enhance operators' workflows on a day-to-day basis. A little bit about myself. Again, I joined SpinSci about 8.5 years ago. I came in as a software engineer, worked my way through to becoming a VP of product, and that's where just going through the several transformations that the healthcare space has gone through, especially with COVID. We've been able to get exposed to all the different pieces that come together to make the digital transformation happen in a healthcare organization, and we're bringing that expertise to now revolutionize the operators console space. And I'm very excited to talk about it, and looking forward to it.
Excellent. Thank you, Rohit. And we also have Cody Clark, who's our VP of Sales, and he's helped lots of health organizations nationwide turn this console into a cornerstone of their care coordination as well. So, Cody?
Yeah, hello everybody. Cody Clark, VP of Sales. Been here for a little over 3 years. I think this is an exciting time and an exciting product for us. I've seen the impact it makes with customers, and I think the impact hearing it from the end users, from the administrators, and from the IT staff has been the biggest driver for me in really getting a feel for how this product works and ultimately the impact that it makes in care delivery for patients, staff members, everybody else. So excited to be here and thank you for your time.
Excellent. Thank you, everybody. We just have a great panel today here. I'm so excited for this. We're going to have a great session. And of course, myself, Nancy, and Justin are here to be your hosts through this webinar. So we're super excited for that. So let's everybody grab your coffee, turn up your volume, and let's get started. Justin, we're going to go through a packed agenda today, so let's just dive right in.
Sure thing.
Let's go to our next slide. Perfect. We're going to start with what is our operators console, or what is a operators console? So I want you to imagine a hospital. Now, when you think about a hospital, it's a really big, busy place, and there's patients and doctors and nurses and everybody running around. Now, imagine there is a person sitting at a computer who knows exactly where everyone is, what's happening, and who to call when something comes up, right? That is the operator, and they are using this system called the operator's console, which is like a central nervous system that helps them have all of the data that they need to make these on-the-spot decisions. So the operator's console is like their ultimate control panel, right? It helps them find people, send messages, and call in case of emergencies. If something serious happens, like for example, someone's heart stops, they can press a button and alert someone right away. So when we talk about the operator's console being like a central nervous system, let's walk through a few of our use cases with that and see that in action. Excellent. So our first use case for an operator's console is you're really like an air traffic controller. So just like at an airport, at a hospital, operators can see where every patient is. They can check which bed a patient is in. So for example, if a family member is calling in and they're asking about their sister that is having a baby and she's in one of the rooms in the hospital and they want to go and meet her. Or they want to talk to her on the phone and see how she's doing. They're going to call into the hospital, and that's going to connect them to the operator, who's going to be able to quickly look up where this person's sister is by their name. They're going to be able to check which bed she's in that particular room. They're going to be able to see whether or not she has been discharged already, who is the nurse and the doctor that have been attending to her. So they have all of this information at their fingertips, and they can route this caller to where to go, which room to go, or they can just transfer the call over to the exact bedside telephone. The second use case is provider search. So if you want to find the right specialist or contact a particular department like cardiology, you have the entire staff directory right at your fingertips. Also, we have paging. So this is in case there is something really important and urgent that happens, if someone's heart stops and you need to reach a doctor really quickly. The console, it helps you locate on-call physicians instantly using this integrated paging system. So if you've ever seen doctors carry around pagers, that's what it's doing. And lastly, we also have code calling. So in case of emergencies, if you've been to a hospital and you hear the overhead public announcement system say things like code blue, whenever there is an emergency that happens, every second counts. So with this operator's console, you can instantly trigger protocols with preset decision trees and alerts to mobilize the right team so that there's no delays, no confusion, and the right people can show up to the right place within seconds. So in short, the operator's console basically makes sure that all the operations around the hospital are happening with speed and precision, and making sure that everybody can know what is going on. And in hospitals, we know hospitals don't really sleep, so every second matters, every handoff matters, every call could save a life, and that's why our operator's console exists, to simplify that chaos. And now we're going to jump into our next session, which is a fireside chat with our CRO, Ashwin. We're going to be asking him some questions really from his perspective on what the business value our customers have seen when using this console. So let's jump over to that.
Yeah, Nancy, thank you for setting up that session. This is Justin Kulik with SpinSci. I am work at SpinSci as a business development manager. I will be helping to kind of guide the conversation here with Ashwin. But nonetheless, we want to use Ashwin's deep industry insights and expertise to shed some light on how SpinSci's operator console solution really is transforming contact center experiences in healthcare. Ashwin, you go ahead and let me know when you're ready. We could just go ahead and get started here.
All good, Justin. Yep.
Sounds good. So, Ashwin, I know you have a ton of experience. I know you've worked with a lot of different customers throughout the healthcare industry and landscape. I want to know what is the potential impact for healthcare organizations that are looking to deploy SpinSci's operator console?
Yeah, that's a great question, Justin. If you look at the status and the state of where a lot of these operator consoles are in the health systems, number one, it's very legacy. It's been put in place many years ago, like in the 90s, and it hasn't really been touched or updated today. Number two, a lot of the health systems are now looking at AI to deflect a lot of the different calls that are there that are coming into these operators. I was just looking at ChatGPT, and they launched their whole agentic AI for operators, right? But today they don't have an ability to drive self-service. A lot of these human operators are taking the workload of all the different use cases that Nancy really provided. And then number three, there is enterprise investments today with a lot of these different health systems in their contact center and in their unified communication platform. But there's a mismatch between where that legacy operator console is and where that UCaaS or CCaaS or enterprise strategy is. If you upgrade one system, it breaks another system. If you upgrade that system, it breaks another system. So you asked about the impact. The impact is transformative with SpinSci's Operator Console because we're adding a layer of agentic AI to drive that self-service capability. That's going to be a huge impact and ROI, which I'll cover, in more detail, and Cody will cover in more detail. The operator console itself is going to be fully connected to the contact center strategy and the unified communication strategy. So the maintenance of it is going to be a lot more simpler. So it's going to be transformative both on the effects of the product, but also the ongoing support.
Great. Thank you. I heard a little mention of some platforms and talking tech stack there. What platforms are supported with SpinSci's Operator Console?
Yeah, Justin, great question. I think if you look at it, there are multiple different levers of pulling this information into a single pane of glass operator console, which you're going to see in the demo. First off, you have CCaaS vendors and contact centers. So the beauty about this operator console is it's agnostic across all the major on-prem contact centers that are out there. And it's also compatible with all the major CCaaS providers that are out there as well. From a UCaaS perspective, we want to make sure that these specific backline messages, code calls are all integrated into the UCaaS system as well. So all the on-prem calling systems and also all the cloud calling systems from a major calling perspective is all integrated. You also have pagers as well. And so a lot of the different pagers you'll see in the demo, we've integrated it, tightly woven it into our operator console that you're going to see. You have on-call scheduling systems, right? That's another lever that we've integrated into the operator console. And then obviously you have the ability to do alert management. So different buttons, different chords, to submit those alerts into this console. We've integrated it all into the console, and you're going to see a very awesome demo from Cody Clark on that.
Great insight, Session. I got one more question for you here, and we'll wrap up this segment, and we'll jump into a demo with Cody. How does SpinSci's Operator Console drive productivity and efficiency for healthcare organizations?
Yeah, I mean that's a big question because there's a lot of features and it's very feature rich that Nancy pretty much covered in the last session. I would say if you look at inpatient routing and you add a layer of agentic AI in there, we can we've seen in a lot of the different deployments up to 60 to 70% of a lot of these routine calls be deflected. So route me to a provider office and you need to understand the provider name. Route me to an inpatient room and you need to ensure that you are connected to that inpatient that's there. A lot of those workflows we can deflect with agentic AI, but we could also drop the call handle time for about 30 to 40 seconds. We've just launched our Smart Directory and Smart Tree product, which Cody is going to be basically able to walk through. What we're starting to see with these smart directories is about 20 to 30% fewer calls being failed to hand off in the directories. We're seeing about 2 to 5 minutes under 30 seconds in terms of the calls that are handled with our smart trees. Our one-click code calls are basically immediately getting emergency teams available and rounded up for that specific situation. And we're also seeing about a 50% reduction in the handle time on dispatching a code call. So what I'm seeing is the ROI is transformative, but you're also going to see the full dashboard and operator console in the CCAS system, which is exciting.
Beautiful. Thank you for your answers, Ashton. Appreciate your participation here in today's session. We will jump over to Cody for the demonstration of the operator console. Cody, the floor is yours.
All me, eh? Perfect. All right. So we'll jump into the actual demonstration of the operator console and then the administration of it too. And that's one of the things we've heard from our customers is having kind of that ability for end users, of course, to have the console itself and be able to manage the day-to-day interactions, but as admins and supervisors and people responsible for those teams to be able to edit the data, to be able to make sure that that data is clean and up to date. And it seems like every time I go visit a customer that the operators are sometimes a source of truth and source of knowledge. And having them with the ability to access the admin side of it and make sure that that we're driving that efficiencies that they're looking for. So quick lay of the land, at least what we're seeing so far. This is just kind of a simple user interface for the operators themselves, the operator console. Now, one of the main components that we'll see is that, hey, I've got a console in here, but what about managing the interactions, managing the calls, managing the actual telephony aspect of it? And for us, I know Ashton touched on it and Justin will hear in a little bit as well, is the ecosystem of partnerships, whether it's on-premise contact centers that you've invested in or cloud-based contact centers that you've invested in or looking at investing in. That's often a thorn in health system side is, hey, I have a legacy console that doesn't integrate with maybe my investments in the contact center space or unified communication space. And that's really what this is here to solve. So from a user interface standpoint, and Nancy touched on it as well, is you've got things like inpatient search, a staff directory or corporate directory to maintain everybody within the organization. Paging, making sure that we're dispatching those secure messages or pages to the right endpoints or groups of endpoints. Code calls, and then along with that is on call as well. So we'll go through the simple search functionality here. Now you'll see I've got a lot of different fields I can type into, whether it's birth date, room number, a bed extension, those types of things. But as I search for a name like John, I can see a bunch of information that's going to come from the EHR. This is going to come through an HL780T feeds that's all in real time. So as patients are admitted, they're discharged, they're transferred to a different room. That's going to come over in real time to make sure we have the most up-to-date information. You've got things like their name, their birthday, gender, the room and bed that they're assigned to, even the attending provider. So what will be written on the whiteboard there inside of the room, and then the bed extension itself. Now, from a bed extension standpoint, you'll notice that that's an orange button. It's clickable. I've got a couple of options I can make. If I'm not engaged on a call, I can simply make an outbound call. However, if I'm engaged on a call with a staff member or a caregiver for that patient, I have things like consult or transfer. So consult's that warm handoff, transfers just pushing the call out to that endpoint. So anywhere we see that orange number, just know it's a clickable link that I can make that transfer happen very quickly. Now, one of the key use cases here is I've seen where operators sit at a single hospital and they manage calls for that single hospital. But I've also seen where they manage 5 different hospitals, 10 different hospitals, and we need to make sure that we can discern what facility that patient is at or what facility am I looking at as an operator. So this could be based on the phone number that's dialed by that person or just based on that search that I did to see that, hey, this is at the main hospital. And the last thing we'll see here is the information icon. We know that this is a very simplified view to make sure that they can see the information they need to see up front. But if we need to drill in a little bit deeper, I can see more information that pops up very quickly of patient details, maybe their contact information, any admission details like was this patient discharged, medical teams, those types of things. And I'm also able to add remarks. So maybe somebody's called a few times to get transferred to this patient, and I want to notify the other operators that may take this call that, hey, we've had to transfer a call to that person a few different times, and I can see some of the remarks history as well. In this case, the other component we can manage is sometimes you have a patient that doesn't want to be transferred to, or you have an inmate from a prison or a jail. And in that case, we have the ability to make sure that the view shows that, hey, this person cannot be transferred to, or we remove them from the system altogether to make sure that we don't have any of those transfers that are not supposed to occur. So for an inpatient search standpoint, we want to wrap it up with making sure that we have the most important information for an operator to see up front before they make that decision to transfer that call. And then, of course, make sure that they can see more information as necessary for that particular inpatient. I can simply clear it, and we're going to wipe all the information from here. Moving on, we'll go to the staff directory, kind of that single source of truth for hospital operations and staff operations. Now, we've got a few different things we can search by, which is, of course, by a name. So if I needed to search up a staff member's name or even the department that they're assigned to. And in this case, let's say ICU. I can search up the department for the ICU, and I can see a lot of different entries here for the ICU and different titles that they're associated with. Now, one of the main things I can see here is extension, alternate extension, their office phone number, and even their paging endpoint. And as a part of what our solution provides is we know that certain providers have different tendencies for how they want to receive these calls. It could be, hey, transfer to my extension first, or no, call my office first, call my cell first. And all of that can be done and left here inside of the notes, or we can order them appropriately, saying that the extension will always be first. If that doesn't work, let's move to the alternate extension. And you'll also see that all of these, like I touched on earlier, are orange and they're ready to go. I can simply click on it and then take action from there, trying to reduce that handle time as an operator. Same concept as we showed in the inpatient search. I have an information icon where I can get more information about that particular person or that particular staff entry. So things like email address. Do they have a backline number? Maybe I need to know their fax information from another clinic that's trying to fax some information. All of that can be seen from here. And it's very customizable, and we'll get into it in the admin section as maybe this data changed. Maybe the operator or the provider got a new cell phone number, and all of those things can be changed in real time to make sure we have the most up-to-date information. So in this case, I'll take away the ICU. I'll look up my favorite employee, which is Mr. Cody Clark. He's the help desk manager there for IT, and we can see different notes that are inputted in there, like the office hours, the extension for them. And then the biggest component is paging as well. So each of these folks that have a pager or some sort of device that they're going to receive a page or information on, we can link those and integrate those platforms together. So in this case, we've done some integrations with different paging platforms out of Indiana, Informacast, those like that, and ultimately be able to provide that single pane of glass and provide that source of truth from a paging standpoint and dispatching the page. Now, the last thing I'll touch on is making sure that we have the most up-to-date information. And when I talk to health systems, I hear, hey, I've had my current console for 20 years, and I've got a bunch of information in there that I need to make sure comes over. And that's actually a very cool feature of our product is we really have two sources of truth for a staff directory, corporate directory. We know you have 20 years of notes built up in your current solution. We can extract those with our tools and import them directly into our system. So you'll see that the source here says operator console, meaning I got it from the previous vendor to make sure I know where that source came from. The other one, especially when working with like teaching hospitals, is Active Directory or some sort of credentialing system for physicians and staff members to get that up-to-date information in real time. And especially in teaching hospitals where you may have a revolving door of providers every 2 or 3 months, we can make sure we have that up-to-date information by capturing the sources that are in play within your organization. Now, paging is handled differently in every healthcare environment, but in this case, you look at the directory entries, I can see I've got paging endpoints or paging numbers. I can dispatch templatized messages, or I can dispatch a free form message, or I can send it to an ID from the operator themselves, a subject, and then ultimately a free form message that I need to dispatch. There's a spill on floor 2 West Wing, or maybe that there's a patient that needs tending to in the ICU. All of these can be done through different templatized messages or a free-form text field, and we can send those messages from here. So different ways to manage paging. It's always a topic of conversation for healthcare orgs on how they manage paging. Code calls. Code calls is incredibly important, and I think it's something that we see that every hospital may do a little bit differently, whether operators manage it or a security desk manages it. But in this case, we want to make sure that the codes are a simple one-click dispatch to send out templatized codes, templatized messages like a weather alert, a weather threat, or I can send that out to a mass notification, or maybe a code pink where I need to send it to labor and delivery only. And all of these are managed in our system as to where these codes ultimately get dispatched. So if I needed to dispatch a code pink, I know what endpoints that needs to go to given the time of day. And then I can also see the live statuses of codes. So I've got 4 different codes that have been dispatched, who dispatched them, what's that operator, and then ultimately the dispatch time for those as well. So not only are we making sure that we can dispatch them efficiently, but we got to make sure we close the loop. Make sure that these live statuses of the codes have been dispatched. We can follow up on them and make sure that they've been responded to as well. All right. So the next thing, and I'll touch on this a little bit, Nash mentioned the smart trees, or basically a way to, as an operator, know who do I need to contact for this. This could be an on-call type scenario of a patient calling in, or a caregiver calling in, or even a healthcare professional. And one of the things that we're doing with this is basically narrowing down that search for who needs to be contacted based on the call reason. Now, some operators manage more than just hospital operations. Maybe they could be calling about an appointment or a return call. But if they're calling about a symptom or like a clinic message, let's say a symptom in this case, and I want to say it's regarding an adverse reaction to a flu shot. And the patient and the caregiver does not really know what to do with this information. It's after hours, it's 10 o'clock at night. And once I start entering in some of these keywords, it's going to pull from the on-call schedule. In this case, I've got my shift management here for who's actually on call for a different time period, start date, end date, their name, their specialty. And what we're trying to do here with this is narrow down that selection so that once I have all the details of the symptom and what it's regarding, is that the system knows where to dispatch that page or that call and send it to the correct resource. And this is something we work on with a lot of health systems for making sure that they have the information from like a smart tree decision tree, saying that if a patient is having an adverse reaction to a flu shot, doesn't necessarily know what to do, this is where that call needs to go. And that can all be done in our software here by managing ultimately who's on call and then having this update in real time to make sure that with the caller information is getting us to the right resource. All right, and then the last thing we'll touch on just from an operator console is we know that calls can happen in a matter of 5, 10, 15 seconds. Patients calling in, hey, I need to schedule an appointment. Great, I can get you transferred. I don't need to go into the directory and search for it. We do have speed dials that are out of the box standard for us to do for different operators and where they call home, different hospitals, and making sure that those speed dials are appropriate for them and getting those dispatches quickly as possible, trying to reduce that handle time. And that wraps up at least the console side of it. And then I'll get a little bit into the administration side as well, which is where, once again, our favorite employee makes an appearance, Mr. Cody Clark, and being able to edit the information associated with him. So when I clicked on that information icon, you can see I've got a bunch of information about Mr. Cody Clark and the information that he has in here. So I can see it from here, but I can also take a quick action and edit it. Looks like Cody got a new phone number. We're going to throw in an 8 on the end there, and he's now working a little bit later. He's going to work till 5:30. So as I save that information, I see that information directory updated successfully, and then I can see more info. That phone number's changed and his office hours changed. So those are all things that can happen in real time as an operator or as an admin or supervisor needs to make quick moves, adds, and changes to the system. And then another common use case is adding external agencies. So sometimes hospitals get calls for things that they feel they probably shouldn't get. Hey, I need to connect with the local pharmacy. It's not a part of the hospital, but as an operator, I want to make sure that I can add in different external agencies or different entries here to make sure I just have that single source of truth and single source of information. And the last thing we'll touch on is what I just showed in the operator console is speed dials. So as an operator's day by day operations changes, maybe they want to add another speed dial. It's something they can come in here and add a new speed dial that then would update inside of the console and show a new speed dial for them to select from. So these are all things that can be configured and managed as a day-to-day operator, and then ultimately making sure that this system here is the most update source of truth in managing day-to-day operations. So. No, awesome. Thank you all very much for your time, and I'll pass it back over to the team.
Thank you so much, Cody. That was an excellent demo, very thorough, very exciting. Thank you so much for sharing all of those features with us. Now we're going to talk to Rohit about how our SpinSci's operator console stands out in the market and how we compare it to other operating consoles out there. So Rohit, over to you.
Awesome. Thank you, Nancy. Hello, everyone. Again, I'm thrilled to walk you guys through a very important discussion on how SpinSci is transforming healthcare operations by overcoming some of the limitations of the legacy operator consoles. Especially in today's fast-paced healthcare environment, every second counts. Whether it's reducing call escalations, enabling remote work, or ensuring airtight security, the technology behind the operator consoles directly impacts the efficiency, the patient experience, and the costs of managing your operator's consoles team. If your organization is still relying on outdated systems, you might be facing unnecessary challenges that slow down workflows and create inefficiencies. But there's a better way. We're in a modern world. And in this session, I'll break down 4 critical areas where SpinSci outperforms traditional solutions. We'll touch on EHR integration. We'll touch on how we're utilizing cloud for remote work enablement. We'll touch on scalability, where you don't need any extra infrastructure. And the most important thing, and top of every executive at a healthcare environment, healthcare organization, is HIPAA compliancy, is security. And we'll touch on 4 of these things. So the first one is the seamless EHR integration. Again, we've talked about this throughout this webinar, where SpinSci, we come from the EHR world. Our bread and butter is EHR integrations, and with that, we bring in the expertise of connecting to an EHR very seamlessly, right? And this is where there's 2 aspects to it. One is when we're setting up our operator console for your healthcare organization as part of our implementation strategy, we have pre-existing instructions. We have pre-existing templates that we can directly just hand off to your team to go ahead and follow those to set up that integration from an EHR standpoint. That makes it a lot more easier from a speed to delivery standpoint and speed to value standpoint, right? You're not waiting months and months to see the value of our operator's console because there's a delay in implementation. That's number one. Number 2 is, again, it's a common problem statement, right? Healthcare providers struggle with accessing patient data efficiently. And that's where using our technology, using AI, using the EHR, deep EHR integrations that we have, when a patient calls in, when a provider calls in, your operator, they need to be able to pull up that record quickly and accurately to make sure they're assisting them as efficiently as possible. And with SpinSci, all of this happens real time. We provide that instant EHR integration, meaning the patient data is accessible at the operator's fingertips. No delays, no switching between multiple systems. And that's where, now think about legacy systems. How many of you have experienced situations where operators have to log into multiple systems? Let it be a SharePoint, let it be an EHR portal, right? Do you want them handling multiple systems while engaging with the patient, while engaging with the provider on a complex topic? No, you don't want that, right? That's where SpinSci can provide that information accurately and seamlessly right there on their fingertips. And with these legacy systems in where the operators need to access multiple systems, it slows down everything. It leads to longer call times, frustrated patients, and operational inefficiencies. Not to mention an additional step of the risk of a human error. And with SpinSci, these inefficiencies disappear. That instant EHR integration, an underlying AI engine will make sure that your operators can handle calls faster, more accurately, with fewer escalations. And that ultimately translates to a better patient experience, reduced call center load, and lower operational costs. Now let's move on to the second topic, the remote work enablement. It's reshaping the way healthcare teams operate these days, especially with the pandemic. It's accelerated the need for flexible work environments. Many organizations are now realizing that an on-premise solution no longer meets your needs. It's legacy. And with SpinSci, we bring in that cloud-based solution, meaning your operators can work from anywhere while maintaining that same level of efficiency as if they're working in a traditional call center. This opens up a whole new world of opportunities, lower office costs, more satisfied workforce, and an access to a wider talent pool, all while maintaining seamless patient communication. Now, legacy systems, on the other hand, heavily rely on on-premise infrastructure. This limits flexibility. This requires additional IT management, and they're not designed for remote operations. And that's where with SpinSci, you're always future ready, whether your team is working remotely or in office or in a hybrid setup. Our platform enables smooth, secure, and flexible operations. And that's where, again, some of the things that Ash and Cody had touched on is the fact that we at SpinSci, we're able to work with an on-premise CCaaS or a cloud CCaaS. And that's where we open up that opportunity to be able to integrate with any environment and provide that level of flexibility to you. Now, the third point here is scalability without extra infrastructure, right? That's where you grow effortlessly. And this really just comes down to your scalability. As your organization grows, your technology should grow with you without forcing you to make massive investments in hardware and infrastructure. And that's where SpinSci is designed to scale effortlessly because it operates on a cloud-based model. That means no matter how much your call volumes increase, no matter how many new locations, providers, or staff members that you add, you don't have to worry about upgrading your infrastructure. We have built our platform to scale vertically, to scale horizontally, to ensure that we have minimal downtime and support the volumes that you might receive. But with the legacy systems, that's a whole different story now. Now, traditional on-premise solutions often require costly infrastructure investments just to handle more users or a higher payload, higher workload. That means more servers, more maintenance, more IT headaches. You don't have to worry about that with SpinSci. Our scalability is simple, cost-effective, and stress-free. Whether you're a small practice with a small operators team or you're a large healthcare system, the platform will grow with you without any extra cost or complexity. So let's move on to the final piece here, which is probably the most important piece when it comes down to data security and HIPAA compliance. Now, at SpinSci, we take this very seriously. We realize our platform touches patient data, provider data, staff data, so on and so forth. And this is our top priority, and I am sure it is your top priority as well. Now, data breaches and HIPAA violations can lead to severe consequences: hefty fines, loss of patient trust, so on and so forth. And that's where SpinSci, this is our foundation. Anytime we build out any new integration, any new software, we build it with the most advanced encryption and compliance tools to ensure top-tier security. Our cloud-based platform follows the highest security standards, ensuring the patient information stays as secure as possible and as protected as possible. Now, there's several encryption technologies that we have in place. We have end-to-end encryption for all data in transit. We use AES 256-bit encryption for data at rest. We have database level encryption. And then we have field level encryption for sensitive PHI. Now, from an access control standpoint, there's multi-factor authentication. We integrate with your Active Directory to make sure that there's a direct integration with your platforms. And then we integrate with the CCaaS platforms to ensure that there's a single sign-on experience. And there's other security aspects of this as well. So from a compliance standpoint, we internally have automated HIPAA compliance monitoring. We have audit logging and reporting capabilities. And we're able to use the reporting capabilities to ensure that if there is any data breach, if there is any malicious activity, we are triggered, we are alarmed immediately. And then the final piece is the data governance itself. From a data retention policy standpoint, we align with HIPAA requirements. We have automated PHI detection and classification, and then we do regular security risk assessments. So now with all of this, we ingrain this not just as something that we need to do to ensure that we protect your patients, to protect the platform, but it's ingrained into our philosophy of building applications and building software. Now, unfortunately, many legacy systems are still relying on outdated security measures that increase the risk of breaches and compliance violations. In today's world, security isn't something that you can afford to compromise. With SpinSci, you get that peace of mind, knowing your patient data is safe and your organizations remain compliant. Now, let's take a step back and look at the bigger picture. Compared to the legacy solutions, SpinSci offers, number one, seamless EHR integration, two, remote work enablement, three, effortless scalability, and four, advanced security and compliance. The question isn't whether you need to upgrade, it's how much longer can your organization afford to stay on legacy systems. If you're ready to enhance efficiencies, improve patient experience, and reduce operational costs, let's connect. Let's talk more about this. Let's double click on everything that we've shown you so far. I'd love to hear your thoughts and answer any questions. Feel free to reach out to me, and thank you for your time. Back to you.
Excellent. Thank you so much, Rohit, for that absolutely excellent comparison and for showing how there really is no other solution out there in the market quite like SpinSci. We've seen the legacy systems, we've heard our customers talk about the pain points they face there, and we've built a solution that just makes sense, that doesn't have you going and jumping through the same hoops that legacy solutions do. And the other thing we've invested in is our partnerships to make sure that you can bring your own favorite tools and come work with us. So Justin is going to touch on that.
Right. Thank you for the transition there. Yeah, so I want to speak about SpinSci and our partnerships. At SpinSci Technologies, the success of our team and solutions are really built on the strength of our partnerships. We work closely with many of the CCaaS vendors out there, ensuring that healthcare organizations have the flexibility that they need to deliver a seamless patient experience. As a partner agnostic company, we empower healthcare organizations to choose the right solutions without being locked in to a single ecosystem. This approach really allows for greater adaptability and helping the business to integrate cutting edge contact center technologies with their existing EHR system. And this is what really kind of sets SpinSci apart, is our ability to develop the mature and strategic partnerships, not only from a CCaaS perspective, but also from an EHR perspective, from an AI perspective. Our partnerships are very extensive and very developed and mature, and that allows us to really provide CCaaS solutions that work in harmony with healthcare workflows and truly do optimize the efficiency and on the flip side, enhance that patient experience for your patient base. Now, we're not only partnering with the CCaaS vendors and different tech partners out there, we're also partnered with an abundance of healthcare organizations across the nation. We are very, very proud to be a partner of over 100 healthcare organizations of all shapes and sizes, from regional partners to some of the more reputable healthcare institutions throughout this nation. One thing, again, that kind of is a testament to SpinSci, our success, and our approach to driving innovative healthcare solutions is our collaborations with our customers. Through our collaboration with them, we are truly able to continuously learn, adapt, enhance our solutions, understand the best practices and the ins and outs of the various healthcare workflows, because there are a handful. There are a handful of personas. There are a handful of different stages in which these solutions are implemented and utilized. But due to our partnerships with both our vendors, our tech partners, and most importantly, our customers, this really allows us to deliver a best-in-class integration to drive both operational efficiency and improve that patient engagement. This goes right hand in hand with our operator council solution, We already have this solution live at multiple customer sites. That being said, if you are interested in learning more or becoming a partner for that matter, so we can enable and develop that operator console for your organization, reach out to us today. This could be a game changer. It's a critical time right now. It's a very hot button topic that we're seeing and getting brought up to by a lot of our customers. So definitely do engage. You can reach out to me personally or any one of our panelists here today in the webinar, or sales@spinsci.com would be a perfect email address to go ahead and initiate the conversation. And that will wrap up today's webinar session. Thank you to everyone who took some time to watch this. I hope you found this session very valuable. Again, if you're interested in seeing a live demo or getting more information, please do not hesitate to reach out to any of this team on this session right here, any of the panelists, or you can find more information available on our socials and or website, www.spinsci.com. We are happy to have any conversations and look forward to connecting with you all. Thank you so much for your time. I appreciate everyone joining.